I'm Brenda Lynn. I'm going to do my head to toe assessment for Health Assessment 2. So first I'll start out with my introduction. I will perform hand hygiene and provide privacy, and I will acknowledge my presence, what I'm doing here, and two patient identifiers along with allergies and assessment of pain level. So I wash my hands and I provided privacy. Hello, my name is Berlin Burns. I'm going to be your student nurse today. Can I ask your name?
Corey.
And what's your birthday?
September 4th, 1991.
Okay, Corey, I'm going to do a full head to toe assessment and it'll take 30 minutes. I have to do that so I can get a baseline information of your current health status.
Okay.
Okay. Do you have any allergies, any medications or foods?
No.
Okay. Any pain?
No.
All right. So as I'm looking at Corey, I see no signs of distress. He is alert. I'm going to ask him a few more questions to understand his level of consciousness. Can you tell me who I am?
Brenda Lynn.
Okay, and where are you?
My home.
Alrighty. And what's the month and the year?
It's April of 2020.
Okay, and what are we doing here?
A health assessment.
Okay. All right, so he is A&O times 4, so he's an oriented person, place, time, and situation. He also has, his behavior is appropriate for the situation. His mood and his facial expressions are appropriate for the situation, and his speech is clear. After I did my introduction and my general assessment, I would do vital signs. In this case, his vitals are normal. Next, I'm going to move to skin and nails. So I would go over the skin to see if he has any excessive dryness, any sores or lesions. I do not see any wounds or anything like that. He does have some macules over him or freckles. I would like to take off all his clothes. I won't do that. And his color is appropriate for his ethnicity. I'm going to look at his nails too. I'm going to see the color and check to see if he has any clubbing. He doesn't. You would check to see the angle of the fingernail with that little diamond. If he did show signs of clubbing, it would mean that he has an oxygen deficiency. Next, I'll check capillary refill. So I'll just okay, his capillary refill is 2 seconds, which is good. If it was any more than that, it would be another sign of oxygen deprivation. Okay, next I'll palpate his skin for temperature. So with the back of my hand, I will touch his skin. All right, his skin is dry and warm, no sign of a fever. I'm going to move on to his head, face, and neck. So I'm going to touch your head. So you'll feel around on his head to see if you feel any lesions. You'll also inspect in the hair to see if he has any infestations, which I do not see. I'm going to go ahead and test cranial nerve 5. So I'm going to have you smile and then puff out your cheeks. And can you raise your eyebrows? You can deflate. And then, okay, good. Close your eyes really tight. Perfect. I'm also going to test sensation. So every time you feel the cotton, I want you to say now.
Close my eyes.
Yeah, close your eyes.
Now. 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 Now.
All right, good. So cranial nerve 5 is intact, which is trigeminal nerve. And then we can test cranial nerve, I don't know. We'll move on, okay. Next is cranial nerve 12. I'm going to have you push your chin against my hand. Okay, on the other side. All right, now I'm going to, just kidding. Go ahead and shrug your shoulders against my resistance. All right. Cranial nerve 12 is intact. I could also inspect the neck to make sure that the trachea is in the midline. I can also palpate the thyroid gland. You shouldn't see it, but you may be able to feel it. I'm going to go on to the eyes, and I will inspect all auricle structures to see if there's any discharge or redness. I'll also inspect to see if there's any lesions. I'll look at his eyebrows, eyelids, and eyelashes. So I don't see any discharge, and his eyelashes are curling outward, and his eyes are the length of his eyebrows. Okay, oh, also, your eyes are situated at your level, so his face is symmetrical. I'm also gonna really look at your eye. So the sclera is white. I'm gonna pull down on one of your eyes. And the conjunctiva is pink, which it should be. Next I'm going to check pupil size and perla. Where did I put that? There it is. Go ahead and look up at me. So I can tell that his pupils are round and equal. I'm going to test to see if they react to light. I'm gonna shine this in your eye. Look at him. Okay. His pupils are reactive to light, and I'm going to test to see if you have accommodation. So I want you to look at my pen, and I'm going to bring it in closer to your face. Okay, he has good accommodation. His pupils constrict with nearsighted gaze. That also goes through cranial nerves 3 and 4. And then I'm now going to do the 6 cardinal fields of gaze to test cranial nerve 6. Okay, so you're going to follow my pen. Okay, cranial nerve 6 is intact. Okay, now I'll move on to the ears. I will inspect the external structure to see if there's any lesions. I don't see any piercings. I'll also feel on the external structures for any tenderness. So, check your ears. Does any of that hurt? No. You could also touch the inside of the ear too. What is that called? Tragus. Whatever. If I had an otoscope, I would look in the ear. I would check to see if there's any redness or lesions. I'd also look at the tympanic membrane, which should be white and shiny. I'll test cranial nerve 8 with a whisper test. So I want you to cover that ear, and I want you to repeat what I say.
Red box.
Okay, so
Green plant.
yeah, all right. Cranial nerve 8 is intact. You can also just go about the conversation to see if he hears you as well instead of a whisper test. Might as well add it in. The nose, I'll see the outside structure to make sure it is symmetrical, that it doesn't have any lesions. I'll also inspect the internal structures to see if there's any asymmetry, inflammation, or deformity, like a deviated septum. So I'm gonna look up your nose. Nose is symmetrical. I see no lesions. Go ahead and look up. Nares are symmetrical, and I do not see any deviated septum, lesions, or anything like that. I'm gonna have you test for patency, so I'm going to have you hold one nostril and breathe in and out. Now do the other one. Okay, that's good. And he had no drainage. What else? Moving on to the mouth and throat, I'll inspect the lips for color, moisture, to see if they're dry or correct. I'm going to inspect the tongue for color and moisture, as well as the gums. I can also inspect the mucosal membrane, the palate, and the teeth. I'm going to go through that, and then I will assess cranial nerves 9 and 10, and 12. Oh, okay. Okay, cranial nerves. What did I just say? 9, 10, and 12. There we go. Okay. So, looking at his face, his lips are symmetrical. I don't see, there's no discoloration. Don't see any, what is it, cyanosis. There we are. They're not dry, so they look pretty moisturized. And I'm going to have you open your mouth. I'm going to look inside. Okay. The mucosal membrane is moist. The teeth look okay. The gums don't look like they have any abnormalities. And now I'm actually going to have you go ahead and open your mouth again and just stick your tongue out and say ah. Okay. And can you take a drink of your water? Wonderful. Okay, so that goes over cranial nerves 9 and 10. When he stuck his tongue out and said I was able to see the uvula and the soft palate rise. And the swallowing was for cranial nerve 10, glossopharyngeal nerve. What else? Oh, go ahead and stick your tongue out. All right, your tongue is in midline. I also want you to say, you can stick your tongue back in. Light, tight, dynamite.
Light, tight, dynamite.
Wonderful. So cranial nerve 12 is intact. All right, now I'm going to go over the respiratory system. So I'm going to inspect him breathing and his rate. That would have been secretly, now he knows, but you would want to make sure that the patient doesn't know that you're monitoring their respirations, because then they may they would think about it. That's weird. Okay, so
Lay down.
no, you're okay. I'm just watching you breathe. All right. So watching him breathe, I don't see him use any accessory muscles. He is in a tripod position, but he can probably breathe just fine with upright posture. If they were in a tripod position and they had emphysema or COPD, leaning forward gives them more space to breathe and expand their lungs. Also, what else was I going to say? Whatever. Okay, now I'm going to go ahead and auscultate lung sounds. I won't make you take your shirt off, but you would not want to listen over a gown or anything. So, it's going to be fun. Every time I'm in my stethoscope, go ahead and take a breath, a deep breath. So this is right upper lobe. Okay. Left upper. Okay. Left lower. Right middle. Right lower. And left lower again. Okay. Then you'd want to flip it around and do it on the bell, maybe? No, just kidding. I'm going to have you turn around and I'll listen to your back. so this is left upper. Right upper. Right middle. Left lower. Left lower again. And right lower. Okay. So that's it for respirations. Actually, I didn't hear any wheezes or crackles. So now we'll move on. Excuse me. Okay, moving on to the cardiovascular, I'm going to palpate the carotid artery, the carotid pulses, and I'll also auscultate the carotid artery. If this was an older client, I would auscultate with the bell of my stethoscope first before palpating the carotid pulse, just in case they may have a clot or plaque. By occluding that artery could break loose, either one of those. So you'd always want to listen first. So I'm going to go ahead and check your carotid pulse. Okay, and you only want to check the carotid pulse one at a time. If you were to do it at the same time, you would cut off cerebral blood flow to the brain. So that's not good. I'd also inspect for jugular vein distension. I would lay my patient back to a 45-degree angle, and I would have them turn their head away from me, and I would see if there was any palpations. So I'm going to have you do that. Just look to the right. Or, yeah. They are laying down, it would show up more. Gosh, what were they doing? But he does not have any jugular vein distension. That's it. If you do see pulsations, if you can't tell if it's an artery or a vein, if you if you palpate the pulsation and it occludes blood flow, then it is a vein. Okay, now I'm going to go ahead and auscultate heart sounds. Okay, this is aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. With this, I would also flip it around and do it with the bell of my stethoscope. So, aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. Let's say you have heard no abnormalities. Now I'm going to check the radial pulse. So let me see both your hands. Okay, and then I'll do the dorsalis pedis. Okay, the rate and rhythm of his pulses are normal and his amplitude is 2+. If it was a 1+, that would be too weak, and 3+ would be bounding. And then, oh, I also have to do the posterior tibialis to do your ankles. Okay. Same as the other two. Okay, now I'm going to inspect the abdomen. So I'm going to have you lay down. So I'm going to inspect for contour and symmetry. So looking head to the side, down by the feet. You would see if the contour was scaphoid, flat, rounded, or protuberant, and his is flat. Looking at him, if he had a shirt, everything looks symmetrical. Excuse me. What else was I gonna do? And the color of his skin would be appropriate for ethnicity. His umbilicus is in midline, inverted. I do not see any signs of bruising. If you would see bruising around the umbilicus, that would be a sign of internal bleeding. Let's see. Now we're gonna auscultate bowel sounds. You want to start with the right lower quadrant because it is the most active. All right, right lower. Okay. Right upper. Okay, he's active in all 4 quadrants. Now I'm going to auscultate for any bruits over the aorta, and I'll use the bell of my stethoscope. Okay. Yeah, well, keep going, I guess. Okay. I don't hear any bruit. So now I'm going to move on to palpation. I can do light and deep palpation. You'll use the pads of your fingers, push down into in a circular motion, starting in the right lower quadrant, and you're doing this to feel for any masses or tenderness. You see that? Oh, if I was sitting in the way. Is anything uncomfortable? All right. If there was any tenderness, you would test it with the rebound tenderness by holding down on the spot where it was tender and then releasing immediately. If it caused more pain, then that would be a positive result. All right, that's it for the abdomen. Now I'm going to go ahead and do musculoskeletal. So you can go ahead and sit up. I'm going to inspect the upper extremities and the lower extremities for symmetry and contour. I'll also inspect, well, that's it. Yeah. Okay. All right, so I'll feel for each joint and the muscles. So the joints should be symmetrical, and the muscles should be firm. Joints. Okay, I'm going to have him go ahead and lift your arms up. And can you put them behind your head? Put them behind your back. Okay. Now go ahead and push against my arm. Okay. And then pull in. up. Not with the elbow. Just with your elbow. No, I mean like this. Okay, and back up. There we go. Okay, can you do your hands too? I want you to push up, and then I want you to push down. Okay, so upper extremities are good. I'm gonna have you move around. Oh, we did that one, so I'm gonna move you around. Have you move around your wrists. Okay, so range of motion is good in the wrist. See that one? Same with that, and I didn't feel any crepitus in any of those. I'm going to move on to the lower extremities. Again, I'll go around. Touch feet too, but not touch feet. Okay, now we'll do the muscle strength. So I want you to push up. Yeah. And pull down. Okay. I know. Okay. Push up. And back in. And back in. Okay. Now I'm going to have him do flexion of the knee, flexion and extension. So go ahead and kick out. Okay. Okay. He's able to flex and extend his knee, and I didn't feel any crepitus while he was moving them. So now I'm going to have you do your ankle too, just move it around in circles. Okay, same as that one, no crepitus, so we're all good. I'm going to test the sensory function of the lower extremities. So, let's see. If I had a tuning fork, I would put that on the big toe to test for peripheral neuropathy. If an individual did have that, they would only feel the vibration for a short amount of time or not at all. I'm now going to do a dull and sharp test. So this is sharp, this is dull. Okay. So I want you to close your eyes. You can put your arm down. I'm just going to touch all over. You're going to tell me which one is sharp and which one is dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull.
Okay, that's finished. Okay. So I guess I can do the neurological system with all the nerves at once. So we'll start out with olfactory. And this tests scent. So I'm going to have you close your eyes. I want you to tell me what the scent is.
Like vanilla or something. It's familiar. It's like chocolatey or something. Like hazelnut or something?
It's coffee.
I don't drink coffee, I don't know.
Alright, well, obviously he can smell. For cranial nerve number 2 optic, I would use the Snellen eye chart. I don't have one. We can also do the confrontation test. So I'm going to have you cover one eye. And I want you to say now when you can see my fingers. Okay? No. Don't look straight ahead. There we go.
No.
Okay.
No. No. No.
All right, that's it. Cranial nerve number 2 is intact. I did this earlier. Perla, I checked his pupils, which they were, his pupils were round, they were equal, round, reactive to light, and they accommodated to nearsighted gaze, so I won't go through all that again. We did cranial nerve number 5, which was light touch sensation. How do you do that again? So and also facial expression. So you'll smile and frown, raise your eyebrows, close your eyes really tight. Wonderful. Perfect. Cranial nerve number 5 is intact. Number 7. Ooh, no, that's trigeminal. Just kidding, we're going to trigeminal. Number 3. So that would be clenching teeth. Okay, now go ahead and stop. Now clench your teeth. Okay, so that's good. That also is, that's light touch sensation. And then cranial nerve number 7 is the one with the smiling, the facial expression. That also has to do with taste, the anterior tongue, which is sour, sweet, and bitter. We tested the cranial nerve number 8, vestibulocochlear, when we did the whisper test. Glossopharyngeal, I had him swallow. I also had him stick his tongue out and say ah. I watched his uvula raise. The vagus nerve also has to do with, oh man. Okay, that's number 9 and 10. And then we did the shoulder shrug, and he put resistance against my hand with his chin and his face. And then stick to his, number 12 was the hypoglossal, which I had him stick his tongue out and say light type dynine. So that completes the end of the assessment.